Oh, no, this is a good story. Well, this is the nurse of the week. I'm so sorry. I know I hooked myself up. So this is the nurse of the week, favorite story of the week, every single week. And this is about an oncology nurse with breast cancer that uses her diagnosis to connect with her patients. And for those who are watching this on the, who are not, if you're listening to this on the podcast, the reason I chose this lady is because when I was scrolling down the news feed to find some stories of the day, she was wearing a pink wig. And I was like, what is this nurse doing with this pink wig? But for those who are watching the edited version, you'll see a picture up on the screen. I love when nurses and just healthcare providers do things like this. So her name is Angela Ringer. And just days after the birth of her first grandchild, Ringer was diagnosed with triple negative breast cancer, which is a more aggressive form of the disease. The diagnosis floored her because she is, like I said, an oncology nurse. I mean, this is what she does on the daily, every single day. She's taking care of patients who have breast cancer and other forms of cancer, and she never thought it would be her, but she was diagnosed with this. She said, throughout the troubling journey, Ringer said she tried to remain positive and dressed in more pink. Quoted of saying, I didn't want to be sad, poor cancer patient. I wanted to do it. I wanted to do it with as much style as I could, so I blinged it up. That's my lady. That's my nurse. That's the kind of lady I like. She put on some bright lipstick, earrings, the brighter the better, she says, scarf, and the pink wig, Ringer said. I love the story. God damn it, I love the story.
Well, I think it's wonderful when someone takes something as dark and negative as a breast cancer diagnosis, especially, the aggressive form of breast cancer is something that usually takes someone's life within just a few months. It sort of sneaks up on them. You have no idea it's there, and then all of a sudden it's there, and by the time they know it, it's too late. So I don't know if that was the case for her or not, but I love that she's a nurse, so she understood the risks and she understood the severity of it. And I love that she just took that, and rather than, if you have a diagnosis like this, it's something so horrible, you have every right in the world to have pity party, feel sorry for yourself, wallow in your misery. I would never judge you for doing that. That's whatever you need to do. But if you're able to overcome that somehow and just turn it into something good to help other people and pretty much just get the most you can out of whatever time you have, then I think that's wonderful. And what a wonderful example she's been for other people.
I love these stories. And the most recent everyday hero that I just interviewed also had breast cancer. And she came out on the other side as well. And being a healthcare provider and being one of these patients, I don't want to say it's easier. At least what she told me was it's easier because she knew what to expect in all of these things. But even knowing what to expect, and you better believe that Nurse Ringer knew what to expect. She worked on a cancer. She worked on an oncology floor, right? But Joyce, the last everyday hero I interviewed, she said that even knowing literally every step that was going to go, it's still a scary process. So for her to be so positive about this and make it so public and be that shining star, she doesn't know what outcome is going to happen. She doesn't know if she was going to get through the process, but she decided, I don't know what's going to happen. I can't control what's going to happen, but I can control how I go through the process. And she did so looking fantastic. She did so in the best way possible. God damn it, I love these stories. Nurse of the Week, you deserve so much more than Nurse of the Week. You are inspiration to so many, Nurse Ringer. I love it. I love it. I love it. Thank you guys so much for watching. I really do appreciate this. If you guys were informed or educated in any way, shape, or form by these stories, please hit that like button. If you liked my presentation of the news, I really suggest you subscribe and hit the notification bell so you know every time Q the Nurse drops some hot, fresh press news. Thank you. Catch you next week. Deuces.